I got the cue, so I'm going to get started. Hi, everybody. I'm Jody Hanson. I am the Director of Public Affairs and Communication for Johnson County Government. Thank you for joining us today for our Facebook Live event where we answer your questions about our vaccination rollout. With me today are Assistant County Manager Joe Connor and Director of Epidemiology for Johnson County Department of Health and Environment, Elizabeth Holshoe. We also have Brett here providing ASL interpreting for us, so thank you very much. Thanks for being here, and I'll go ahead and let Joe get us started with today's update.
Good afternoon, everyone. Thank you, Jody, so much for the introduction. Again, Joe Connor, Assistant County Manager for Johnson County Government. Part of my responsibility as Assistant County Manager is the Department of Health and Environment, and so I'm happy to be here today to provide some more information to you as we continue down our vaccination program for COVID-19. Some of the things that are happening this week, I want to make sure and reiterate. We have yesterday we had our clinic for law enforcement partners at the Sunset Office Building, and that should be our last go around with that group until their second dose is due. We have a clinic scheduled today and tomorrow from 9 to 1 at the Oaken Fieldhouse, and those are scheduled for the 80+ population as well as second doses for our healthcare workers. We have since added this week second dose clinics for both the Pfizer and Moderna vaccines at the Arts and Heritage Center on Wednesday, Thursday, and Friday. I'm going to let Elizabeth talk about that in a little bit of detail in just a moment. The other thing I wanted to mention from last week that we've implemented, we talked about some changes that we've made to our technology systems and to the way we're communicating with you. And we've implemented over the weekend, and it seems to be working pretty well now. As new surveys, interest surveys are completed, we are sending a confirmation email within the hour of receiving that. Our hope is that people will not continue to duplicate the survey, and that they will have an understanding and a firm confirmation from us that the survey has been completed and that we have your information. We're continuing to also mine that data and make sure it's clean on a regular basis so we know how many are actually left in our survey and how many accurate surveys do we have. So again, to assist us with our planning and our decision-making efforts. So those are a couple of things that have happened since last week, since I was on this last week. I think they've been very positive for our vaccination program. I'm going to ask Elizabeth now to talk about the additional second dose clinics that were added for this week. So Elizabeth or Ms. Holshoe, please help us with that.
Absolutely. Good afternoon, everyone. So we scheduled 3 additional second dose clinics for this week. And so these doses are slotted for individuals who received their first dose through the Johnson County Department of Health and Environment. And the reason why this is because the way the federal government is allocating doses to each of the states and the jurisdictions, it's based on where individuals got their first dose. So when Johnson County received 5,000 first doses of Pfizer this week, in 3 weeks, we'll receive 5,000 second doses so that we can give second doses for all of those individuals that we gave first doses with. So this week we have reached out to people who have been due for both Pfizer and Moderna doses through February 11th for Pfizer and February 12th for Moderna. And you should have a link to be able to sign up for those appointments. If you received your dose through us, your first dose, and you did not receive an email from us today, please reach out via email to jcdhe@jocogov.org, and we'll be happy to get you that link. It may just simply be that there was a mistype in your email address and maybe it just didn't go through. We want to ensure that everybody who received their first dose through us can get a second dose as close to that due date as possible in order to obtain full immunity as quickly as possible. And so again, those additional clinics this week are on Wednesday, Thursday, and Friday. And if you can't make one of these and you're due for your vaccine, that's okay. Stay tuned. We'll get you guys another email and we'll get you signed up for a clinic at some point in the near future, hopefully next week. And just remember that you can be up to 42 days from your first dose to receive your second dose. So you have a little bit of time. If for some reason you can't get it this week, that's okay. We'll get you in as soon as possible. Now, we also have a number of other clinics this week, as Mr. Connor was mentioning. Really, our hope for this had been for a large number of our 80 plus residents. So remember, we've talked about this a lot. For our phase 2, tier 1, which includes that 65 and up, due to limited doses, we have been prioritizing 80 and up individuals. And the reason for this is they tend to have more severe outcomes from this disease. They tend to be hospitalized more. So there's a burden on our healthcare system. And also because of who they are also around, they can spread the disease and cause, outbreaks in facilities and things like that. So we're really trying to focus on this 80 and up. Unfortunately, because our link is public and has been public and is sort of floating around all the places, a lot of our appointments got filled up before we could even send messages to a number of 80 and up individuals who are waiting for the vaccine. So if you are one of these individuals, we sent you an email today, if you're under 65, and let you know that this is really only for our healthcare workers who need to get that vaccine, who didn't get it previously, and the tier 2 phase 1 priority group. So I know everybody's really interested in getting the vaccine. I know a number of individuals are probably refreshing that link daily to see if we have new appointments available. But really, and this is something that we have been talking about in the Department of Health and Environment for almost the last year, is really when we talk about COVID pandemic and how it affects us, we're really in this as a community. And so I know people want to get the vaccine, but we're really asking you to please wait your turn. We need to prioritize these really high risk groups and people who are really impacted by coronavirus and COVID-19. So if you sign up for it and it's not your turn, please just go ahead and cancel it. We will get to you. And as we continue to say, doses are just coming in sort of in a trickle, about 6,000 doses, 7,000 doses a week, which does not cover a lot of our residents. So we really just have to be very targeted with how we direct these doses and who we get those into the arms of.
Okay, thanks very much, Ms. Olshu. Just to kind of follow up on the effort to try to get our most vulnerable and the 80 plus folks into our clinics. There was some concern that we had this week with the weather changing for this week and really next week with the outlook, the forecast not being very positive. So we're going to continue to contact folks as appointment slots come open in the 80 plus category. We will continue to have our warming buses there. We will continue to have parking lot transportation to the front door. We'll continue to provide the drop-off area at the Oaken Field House. So we'll leave it up to you if you feel comfortable coming out in this kind of weather. We're here to try to make the experience as quick and as warm as possible. If you're not, please don't feel like you're, we will work to rescheduling you. We will work to make sure your survey is still active, and you will receive the vaccine when it's more appropriate from a weather perspective. But we want to leave that choice up to you and your families. If you feel comfortable coming out in this weather, we've made some additional changes to be able to serve you in that capacity. The other part I wanted to mention today was we've done some surveying of independent living centers. These are centers that house generally those above the age of 65, the majority, but are not affiliated with a long-term care facility. They're not licensed, and therefore they're just apartment complexes that serve a certain age of population. These folks are in need of vaccine. Quite a few have already received vaccine, through their apartment complex or other relationships that they have. But we've gone through and identified about 1,600 folks in those settings that would like to have the vaccine. So our solution for that is going to be partnering with Hy-Vee to provide mobile services to bring the vaccine to those facilities. So we are working to finalize and should make an announcement here in the next couple of days about what that partnership is going to look like. And again, as long as vaccine supply remains fairly stable, we don't see a big decrease in vaccine, we'll be able to supply Hy-Vee with that vaccine to go out to these independent centers and to receive the vaccine there in their apartments. So again, more to come on that here soon, and look forward to that partnership with Hy-Vee.
Another really great partnership that we have is with Children's Mercy Hospital here in Kansas. And really, as I've talked about before, their big interest because the vaccine isn't licensed for the most part for children, they don't have anybody in their patient population to immunize. So they want to do what they can to protect their kids and have offered to run our vaccine clinics for all of our K through 12 educators and our childcare providers. So last week they did 2 clinics at an Olathe High School. Olathe was kind enough to let them use their facility, and it was for all 6 public school districts. And in the course of 2 days, Children's Mercy immunized 3,500 individuals from our 6 school districts, predominantly SPED teachers, special education teachers, paras, aides, as well as some additional staff that we were able to do because of some vaccine allocation opportunities. This week, tomorrow, the Children's Mercy will be doing a mobile clinic for the School for the Deaf, just for their staff. And then this coming Saturday, they will be doing about 1,000 doses, between 1,000 and 1,100 doses for some of our private parochial school staff and our childcare providers, which includes both homes and centers. And so at the end of this week, it looks like we will have immunized probably close to 10 to 20% of this entire population, this K through 12 and childcare population, which is great. It's a step in the right direction. And so we're hoping, as we keep talking about sort of just getting through each of these populations and being able to move on to the next phase. And so as we move through this in the next few weeks, we can hopefully complete that immunization, and that way we can refocus those doses, that we've been using for our K through 12 and our childcare to completing the other components of phase 2.
Okay, thank you. And I guess I just want to end our presentation by talking about, what to expect a little bit into the future. I mean, I think our systems are in place. Our hospital partners are already asking us for more vaccines. They can use more. Children's Mercy is going to be able to use more, and we'll be able to use more. So as soon as we're starting to touch a lot of our subpopulations in Tier 1, and we want to continue to do that. And we'll just hope, just waiting for the day when a lot more vaccine shows up, and we'll be ready to distribute it and get into people's arms quickly. So as you can see from our activities that's been described, what we're receiving is turned around in that next week and being given to people through the immunization process. So another successful week, I think, for us this week.
Great, thanks to both of you. I'm going to take some questions that we're getting on Facebook, and you were just, Joe, there kind of finishing about the number of doses that we're getting, and we're getting a lot of questions and continue to get a lot of questions about the low number of doses that the state is getting, that the county is getting. What can you tell people that are asking about that?
So we've asked at every level of government that we're aware of, and I think Ms. Holshoe can attest to that too, because I know she's made calls to try to solve the vaccine production to getting it to local health departments mystery. And I don't know the answer to that. We have asked both of our U.S. senators and our U.S. representative for this area for assistance with that. We've asked some folks in our state delegation for assistance with that. So we've tried to call all the people that we have connections with, or to try to better understand and to predict, what we're going to be able to get into the future, and why so few doses. I do know that what the federal government is doing for first doses is it's based on population. So that's pretty easy to track. I believe Kansas is around 1% of the U.S. population. Correct me if I'm wrong there, Ms. Holshoe, but so if they have so many doses, 1% come to Kansas. That's a pretty easy calculation. What we can't figure out is why is the number not bigger? Why is not more being distributed across the country? And we just don't know the answer to that. Again, we were asking all the questions. We're trying to get assistance from our federal and state delegations to help us with this. So far, nothing has shown any light on how that process works. If you got anything to add, Elizabeth, please do so.
Yeah, I was just going to add, you're absolutely right, about 1%, and that's our understanding, comes to the state each week for allocation. And usually the state doesn't find out what that allocation looks like exactly until Tuesday. And then we don't find out until either later Tuesday or Wednesday how many doses they're even allocating to us. And then it's in the next couple of days that we get those doses. If you are interested to see what it looks like for Kansas, what the data looks like in terms of vaccine allocations, you can go to kansasvaccine.gov. And on the top right, just click data, and it has the weekly allocations by county. And so you can see how many doses Johnson County is getting compared to the other counties, and see some other general information about the vaccine doses here in Kansas. So if you're interested in getting a little more data and seeing a little bit more, you can definitely go there and look.
And so we know how many doses we get a week. So I know for this week, I think the number was 5,850 doses, unless there were some added. So are other places in Johnson County getting additional doses, or are they all coming to us and we're distributing?
So for the most part, for some doses are going straight from the federal government to our pharmacy partners. And so when we've talked about the federal pharmacy program and partnership program, so those are the individuals who are immunizing our long-term care facilities, our skilled nursing facilities, our assisted living facilities. Those are coming completely separate from that allocation. They come straight from the federal government. Additionally, as we have begun talking about, there looks to be about, I think it's 8,700 doses coming to 32 different counties to pharmacies here in Kansas in the coming week or so to start immunizing some residents. That is also coming straight from the federal government, is allocated separately from our doses. But outside of those doses that are going directly to those pharmacy partners, everything else comes to the health department, and then the health department allocates it out from there. So that means that our health systems who, in the first few weeks were getting their own doses, that's no longer happening. All of the vaccine comes into the health department, and then the health department is responsible for passing that out to our partners to immunize other residents in our phases and our tiers.
And we do have some questions about healthcare systems. So this week, were we able to give any doses to healthcare systems? And then when the healthcare systems get them, how are they deciding how to use them? How are they making those priority decisions?
I'll let Elizabeth talk about how much they got. I just want to state clearly that the hospitals, when they receive doses from us, are limiting their doses to 65 and over in their patient populations that they already know and that they're already serving. At least one is taking general public inquiries, or those that are interested, they'll take your information. But at this point, they're continuing to follow the lead of our lead as far as who's priority in this county.
Absolutely, and we meet with them weekly. Joe's on those calls, myself, Sami, and the entire purpose is to make sure we are all on the same page and that we're working in concert. This vaccine rollout is bigger than any one entity could do, and we really need to be sort of lockstep and moving forward to immunize as many residents as quickly as we possibly can. I will say that this week, both Menorah and St. Luke's both received vaccine, and they had not been part of that initial allocation to our hospital partners, I believe 2 weeks ago. So we are trying to ensure that when our additional hospitals want doses, if they have not received them previously, we are allocating those out. And again, it's sort of a game of looking at how many second doses we have to do each week, how many first doses we're getting in, what our capacity is in terms of staffing and vaccine clinics, and how to best utilize those doses and get them into the arms very quickly. So each week we're working with our hospital partners, we're working with Children's Mercy, and as Joe Connor mentioned, Hy-Vee for our independent living. So really trying to get vaccines as sort of widespread as we possibly can in our community.
Thank you. We're getting some questions about the 80 plus group. Are you able to tell us, even if it's a ballpark, how much progress we've made in that age group and kind of what's left and how much longer we think it's going to take to finish our 80 plus population?
So those numbers are a little challenging, and for a couple of reasons. So we can talk about what we have on our side of the world, what we know about, but also in the past couple of weeks, we've had our hospital partners immunizing. And so, and I think I was asked this yesterday. So if people have signed up for our survey and said they're interested, they're on our list until they are not. And so if they've been immunized at a healthcare system, we may not know that. So I believe we still had it's between about 6,000 and 8,000, and that number's probably decreased since last week to be immunized. But then you also count the fact that we gave several thousand doses to hospital partners, that will have decreased it. So my hope is that if we have another good week of good dose allocation and being able to run some larger clinics, I think we could be pretty close to being through those at that time. But again, a lot of it is based on allocation.
Yeah, I just would follow up and say, I think that in our long-term care facilities, again, we don't have a lot of control of it, but it's our understanding that the majority, if not all of those, have had their first dose. So that's going to be a large number of seniors, and especially in the 80 plus category. We've talked about the independent living, the need there. So there's 1,600 that remain. Whoever else is living in those facilities has received vaccines. That's going to catch a lot of 80 plus. So it's coming in from a lot of different sources, but I think there's been pretty good progress made, to Ms. Holshue's point.
And if somebody did take our interest survey, but did get a vaccination somewhere else, they don't necessarily need to take any action to take themselves off the list, correct?
No, they are, they can just ignore our emails when we send them, quite honestly. You know, we have 600,000 residents, 90,000 plus of those are over the age of 65. As much as we would really like to have that feedback and know when exactly you got your dose and remove you from our list, with numbers like that, it's just really not feasible. So you can just automatically press delete when you see an email from the Johnson County Department of Health and Environment about a vaccine dose. I still recommend you read our daily newsletter and all of the other information we have. But for any vaccine emails, feel free to delete.
And then can you just reiterate about how much progress have we made with our educators, that category, and maybe some projections on what's to come for getting those vaccinations complete?
People are wanting my crystal ball to be working today. It hasn't worked for the last 11 months. Yeah, so our educators, I think we're probably actually close to probably between 15 and 20% actually of, by the end of this week, of our childcare K through 12, both private and parochial and public school districts. So again, it's a game of doses and how many we need to get through. But this population is about 25,000 residents and individuals between all of those different groups. And so, you know, we were pulling the numbers and we immunized just under 5,000 of those. So I should have by the end of this week. So we're going to get through this, you know, hopefully again in several weeks but it's all dependent on how many doses we can allocate out. And so as you can see, there are a lot of priority groups and a lot of individuals in each of these priority groups in this phase 2 tier 1, probably 125,000 residents in just that tier and phase. So
somebody asked about how many doses are given a day in Johnson County. Is there a good way to come up with a daily number or an average number?
You could probably take the number of doses that we receive weekly and divide it by 7. And so that's going to vary week to week, depending on what that allocation looks like. But, you know, basically the doses we get in this week are used by next week. So you can sort of just do that simple math. But everything, I feel like a broken record on these because it's all about how many doses we get from the state.
Yeah.
Doses the state gets from the federal government.
You know, what news do we have about the pharmacy program? I've gotten some pop-ups on my computer with news that Walmart is going to start vaccinating. So I don't know. I know that just kind of broke. So I don't know, Elizabeth or Joey, either one of you has, you know, what's the updated information on pharmacies? When can people expect to be able to get a vaccine at a pharmacy in our area?
So our understanding is that there will be Walmart, there may be a Hen House and a couple of Price Choppers who are all included in this first round who signed up. Now, whether that means they're getting doses in this first round is a question. Again, at least thus far with the federal pharmacy program, we, the local health department and even the state health department haven't necessarily been informed about how many doses are going into the pharmacies every week. But we're hoping that will be improving with this new retail pharmacy program. But again, I believe it's 8,700 doses across 32 counties in the state for this first week. And, you know, they hope to increase that. I know that there's another vaccine that has submitted for their EUA, their FDA's emergency use authorization. And I believe that meeting is happening at the end of February. So, you know, if we get another vaccine licensed, that will help tremendously in terms of capacity because we'll have more doses coming into our county throughout the country. So still no answer. It may not be a large number. It may only be 1,000 or 2 for residents. And I because it's each within the certain pharmacies, they do need to follow our guidance. So the tiers and phases, so they should be immunizing just that 65 and up population. But how that's going to look, it's very, very separated out the way that the federal government has opted to sort of allocate these doses to them.
We had a question about St. Luke's specifically. I think you mentioned that St. Luke's was one of the healthcare systems that got doses this week. Is that correct?
I don't know if they've picked them up yet, but they are picking, we have allocated out some doses for them.
Okay. And then the question was, are they only being used for people on the Kansas side versus people that live in Missouri? Do you know that?
Well, I think that the agreement that the hospitals came into when they first started with the vaccine program was they were to immunize their staff, all of them, and their patients, all of them. And so that's what they came into this program with. Now, when we started being the central hub for vaccines, the agreement that the hospitals are operating under that agreement. So we feel like there's going to be a vast majority of Johnson County residents that will be in that in their patient population, but their goal is to immunize their patient population, not just the Johnson County residents. And I think I understand why from their perspective. They want to make their health system safe also. And that's the agreement that they came into it with, gosh, how many weeks ago that was when they signed up.
Okay. Anything else that you want to either recap, something that you thought was really important for people to hear today, or maybe something we missed that's on your mind?
I'll just talk about when I was on, I think last week, we talked about some changes internally. We were trying to have more capacity in our call center, more ability to respond to emails and voicemails quicker, and a larger ability to ensure that people's individual requests, is my survey still valid? Why haven't I been contacted? And we've made some improvements internally, and I hope that folks are starting to see a difference there. We're measuring how we're doing on all those different areas, and we'll be tracking if we need to increase resources in a certain area to bring up our performance. So hopefully, from a customer service perspective, you've seen some improvement.
And Elizabeth, I'm going to turn one more question to you. Thanks for that, Joe. So a couple more specific questions about their second dose and the due date. So from what I understand, the people that got reached out today were people who were due on or before February 11th for a second dose of Pfizer. And then for Moderna, those due on or before February 12th. So if somebody has a due date of February 12th for Pfizer for their second dose, when can they anticipate getting an email?
Yeah, excellent question. And so this is sort of our shuffle of when we have vaccine clinics. It's very difficult sometimes with the number of people coming in to separate out Moderna doses versus Pfizer doses. And it's vitally important that you get the same dose that you got the first time. So for those reasons, we are doing separate clinics. So this week it's Wednesday and Thursday for Pfizer, which is why it's through the 11th. And the Friday is the 12th, and that's a Moderna clinic. So if you are due on Friday for a Pfizer dose, your second dose, then stay tuned, and we will either reach out to you hopefully this week, at the end of this week or early next, and get those clinics set up for you and those appointments. And next week, we will have a large number of our 80 and up who are due for their second doses as well with Pfizer. So we will be doing lots of second dose clinics next week.
Okay, well, as always, thank you so much to those who are watching on Facebook and asking questions. Again, we tried to go back either this evening or tomorrow to put in answers to ones that we might have missed on this event. So thanks for asking those questions. We'll get those answered as we can. Thank you so much to Joe Connor and Elizabeth Holshoe, and also Brett for being here. And just have a great rest of your day.